The outbreak of the COVID-19 first started in China at the end of 2019. As many countries are still struggling with the virus, Taiwan has taken it under control with less than 500 cases. The island with 23 million people is only 81 miles away from the mainland China. It has close economic ties with the country, and people travel frequently between two places.
Everyone at the airport was spraying, protective spray, and our luggages were being sprayed and cleaned.
Taiwan has learned from the past experience in the 2003 SARS crisis. The COVID-19 reminds people of the similar scenario. The government banned flights from China and entrance of travelers who have been to China in the last 14 days in early February.
I think they really did make certain right decisions to protect Taiwanese people. Since we experienced the SARS in 2003, which there were a lot of sad news happened. So I think not only the government, the people are also highly alerted.
Anyone who enters Taiwan, including citizens, has to be in the mandatory 14-day quarantine. Passengers need to fill out a form to report their travel history, symptoms, and register their phone numbers, address of their quarantine location. The government tracks the phone signal to make sure they do not step out of the house. Whoever violates the home quarantine rules will face a heavy fine, up to $33,000 US.
We're following the rules, and actually, if we go out, the police will receive the message. So, yeah, it's not possible to go out.
But if you follow the rules, people in quarantine will receive a free food package and stipend of $33 US per day. Mass rationing system also helps the battle against the COVID. Taiwanese government has imposed an export ban on masks in late January to meet its domestic needs. The mask rationing policy allows people to buy 2 surgical masks per week with a price of 17 cents each. Passengers on the subway have to wear masks, otherwise they cannot get into the station and will get fined. To enter public places like restaurants and grocery stores, people have to wear a mask and get their temperature checked. Higher risk places like hospitals have stricter rules. When people come to the hospitals, they have to insert their national health insurance card into the reader to make sure they don't have any travel history in the past 14 days.
Everyone around me was doing all the caution of not getting the virus. So I felt much better and much safer.
The latest statement from the U.S. Health and Human Services says Secretary Alex Azar will visit Taiwan in August to strengthen the cooperation to combat the COVID-19 pandemic.